Bring in Travis Dhanraj in Toronto. I mean, staggering numbers by any degree. Travis, thank you so much for joining us. I want to ask you about the testing, because so much when it comes to the case numbers in this country depends on testing. The Ontario Premier, health officials criticized heavily because of the lack of testing. Any progression, any development on that front?
Well, you heard the Premier come out a couple of days ago, Anthony, and he was really frustrated. He made that very clear that he wants to see these testing numbers in Ontario go up. Ontario is testing the least number of people per capita than any province in the country, and he has set a goal of 13,000 tests a day. Now, yesterday when we got those numbers, they were about 4,000 or so, just over 4,000 tests. So we're not at that marker yet. But what health officials are saying is that initially they were in need of supplies, like the reagent necessary for testing. They wanted to get some of these assessment centers up and online, and they needed to ramp up testing capabilities. Well, now they have all of those supplies, but what they are saying is that they had a significant backlog when they did not have those supplies, and now they're trying to get through that backlog and up to that 13,000 number. We've just got the updated numbers of tests that have been done. This is since the outbreak began in Ontario. That number sits right now at 94,271, but certainly we are not seeing that 13,000 goal met. And there's a lot of concern for long-term care workers, long-term care residents. We have seen over 60 outbreaks here in Ontario, and the Premier says that he wants to see all of those workers and all of those residents. In fact, he wants to see all healthcare workers, frontline healthcare workers, tested in the province. Now, health officials said yesterday we're not at that point yet, but certainly they have widened the guidelines. They sent out new guidelines for testing yesterday so that more people can get tested. So really what the true test will be is these numbers next week, whether or not we see that number significantly increase or not, Anthony.
And connected to the cases and potentially the outbreaks at the long-term care homes, sadly, is the personal protective equipment and the lack of. We learned this week that many of them, half of the supply in Toronto, was defective in terms of face masks. I mean, that's just one element of the personal protective equipment. Where is Ontario as a whole, where the long-term care homes specifically, in terms of procuring and having enough of these PPEs to really sustain them through what has become an incredibly challenging situation?
Well, this has been really the huge issue for frontline healthcare workers, and particularly long-term care workers as well. We know the situation that the province went through, where there were masks that were allegedly stopped at the border, 500,000 or so, that eventually came through. This is when they were having issues with 3M and the Trump administration, that Defense Protection Act. Well, now that issue has been solved, and the Premier has said that really we have to rely on Ontario to ensure that we have proper personal protection equipment. The health minister has said that there is an adequate supply, but we continually hear reports almost on a daily basis of PPE at hospitals and also in long care facilities being rationed. There's also a report out today that in Ontario and also some other provinces, there's reports of stolen PPE and facilities having to lock up their personal protection equipment and ration them. So it is crucial right now. The Premier says that it's all hands on deck, that he is continuing to talk with the business community to try to get some of these face shields, try to get some of these N95 masks and also surgical masks in place. But still, it is a hurdle, and it's one of the biggest problems in terms of that infection rate.
Yeah, right now, a little more than 5,600, that number changing by the day and going right now in the wrong direction.